Good morning, everybody. I'm Riddhi, your host for today's live from All About Skin Wellbeing team. I'm sure all you must be keeping good in health. Today, we are going to discuss about our skin health and focus on psoriasis. Psoriasis is a condition in which skin cells build up and form scales and itchy, dry patches. Psoriasis is thought to be an immune system problem. Triggers include infection, stress, and cold. The most common symptom in a rash on the skin, but sometimes the rash involves the nails or joints. It can start at any age, but most often develop in adults between 20 and 30 years old and between 50 and 60 years old. It affects men and women equally. In today's digital world, it's a boon or a blessing if we can get to hear from an expert dermatologist online about psoriasis and its type, how we can prevent it, the kind of test required for diagnosis, the right treatment and management approach for an early relief. So, ladies and gentlemen, boys and girls, we have with us renowned dermatologist of India, Dr. Nydile S V. It's a skilled and experienced dermatologist who is dedicated to helping her patients achieve healthy, beautiful skin. With years of experience in the field, Dr. Nydile S V has a deep understanding of the complex and varied needs of her patients, and she is committed to providing personalized care to each and every one of them. Good morning, Doctor. Very warm welcome to Dr. Nydile S V. It's a pleasure to have you join us today with this beautiful session and very important topic, psoriasis. First of all, I would like to ask you, Doctor, what is psoriasis?
Hi, good morning. So psoriasis is a immune-mediated disease, meaning skin is affected because of it's an autoimmune condition where there will be patches like scaling, plaques on the skin. So it can affect any part of the body, but most commonly it is seen on the scalp or elbows, knees initially. So it's an immune-mediated condition wherein normally in skin, the skin cells grow and shed in a month. That is in normal individuals. But what happens in psoriasis is this becomes faster, like it gets 10 times faster. So the skin starts shedding within 3 to 4 days, and this results in piling up of the skin cells on the skin, resulting in this scaling and patches we see on the psoriasis.
Doctor, what are the causes that shows the symptoms of psoriasis?
So there is no absolute cause here because it's an immune-mediated disease, and there can be a genetic component also. And genetics, immune, and also some of the environmental factors like weather or any infections can trigger the psoriasis in patients.
So it does mostly depend on individuals' eating habits. They have to keep a check on their nutrition, proteins, and diet because mostly it is based on immunity, right?
Yeah, but it's all just a factor in the costume. It's not the sole response. Diet is not the sole responsible for the causing of psoriasis. But once you get psoriasis, then definitely you'll have to keep an eye on your diet, like consuming high protein diet, and will help in clearing up the psoriasis. Well,
Doctor, who gets psoriasis and is it contagious?
psoriasis is not contagious. It's just psoriasis. It can occur in anybody, like men, women, even children can get affected by psoriasis. It's most common in men compared to women, but it can affect anybody in the world.
Doctor, what can be the psoriasis to be cured? How can psoriasis be cured?
There is no cure for psoriasis, meaning like we can get treatment and keep it under control. Like, we can be well maintained, I can say. Like how if you get diabetes, you just get treatment and keep it under control. It's just like that. Psoriasis, because it will have periods of remissions and exacerbations. So whenever you have psoriasis, there is nothing to worry about. You can get, there are a wide variety of treatments nowadays, and definitely it can be under well maintained.
Mhm. What are the tests required for do psoriasis? Because sometimes this skin peels because of using some of the detergents or anything. It happens in the hands or any part of the body.
Usually, psoriasis is easily diagnosable. If you visit a dermatologist, it's easy to diagnose by seeing the signs and symptoms. But if we want to still make sure, then we can do skin biopsy, wherein we send it for histopathology, and we can confirm the diagnosis.
Okay, doctor. What treatments are available for psoriasis?
So, coming to treatment, psoriasis can be treated with many things, like depending on the severity of the disease and where it is affected, which part of the body it is affected. Since it can affect all the body, scalp, nails, everywhere. There is three types of treatments, like topical, that is with the creams, ointment, solutions. Then there is something called phototherapy, wherein we use different types of wavelength of light and treat the condition. And also, if the disease is very severe and not responding with just the topical, then we'll go to systemic treatments with tablets and injectables.
Okay. Does therapies work on psoriasis?
What kind of therapies?
Yes. Is only medications and injections available for treatment or therapies wherein you need to check on your diet or specific exercise you need to continue on for psoriasis?
Basically, psoriasis can be triggered by various factors. Like one of them is stress. So,
Mhm.
a patient who is stressed, he can, do the other things like yoga or meditation and to keep a check on diet. There's something called anti-inflammatory diet, wherein the patient can consume good amount of vegetables, fruits, and all the high amount of protein, because he's losing a lot of skin cells.
Yes.
He needs protein, so all this will help definitely in controlling the disease.
Doctor, what makes psoriasis worse? If person has been diagnosed with psoriasis, what makes it more worse?
So basically, there are certain trigger factors for psoriasis. Like I told, stress is one of the trigger factor, and some of the illness can trigger the psoriasis. Like if they're genetically prone for psoriasis, like streptococcal infection can trigger a psoriasis. Particularly, there is a psoriasis called guttate psoriasis, wherein it follows after a streptococcal infection. And other stress factors like weather, like cold weather, can aggravate the psoriasis, because of there is less humidity in the air. And other factors like diet, wherein you are consuming too much of unsaturated fatty acids and all that.
Doctor, how can we learn more about psoriasis? Because a lot of individuals doesn't know, and when is the correct time to visit a dermatologist?
Okay, so there are a lot of information available online nowadays. There's something called National Psoriasis Foundation, that is psoriasis.org website, wherein you can find all the information about psoriasis. And when a person has a dry, itchy scaling on the scalp, especially initially it will start on the elbows or knees. When the patient notices such signs, the scales will be very particular here, will be a little bit silvery in the color. So if the patient notices such signs, they can visit a dermatologist and get it diagnosed.
Doctor, what are the prior precautions to be taken for to avoid psoriasis?
So if you're genetically prone for psoriasis, like if your mother, father, siblings, anybody is having psoriasis, all you have to do is manage your stress levels and follow a good diet. That is one thing, but still it's an immune mediated disease and it's not in our hands. So
Mhm. Okay. What are the most common triggers of psoriasis?
same thing, like I told, stress is one of the common trigger factor, wherein whenever the patient is having a lot of stress, the psoriasis can trigger for the first time, or even when if the patient is suffering from already psoriasis, it can increase the symptoms and make it worse. Other things like weather, like cold weather or any illness can make it worse. Something like alcohol, consuming alcohol also can make psoriasis worse.
Okay. What are the home remedies for psoriasis? If person doesn't know that that person is diagnosed with psoriasis and prefers to do some home remedies because of itchy or rashes, what are the home remedies that can be done?
Basically, home remedies in the sense, patient should keep the skin moisturized as much as possible. Applying coconut oil or basically keeping it moisturized is one of the key factor, and also maintaining a good diet.
Mhm. Okay. Can sun help or can cause like having sometimes it happens that a diagnosed person does not know that he or she is having psoriasis and they prefer to walk out in the sun and feel more itchy about it. Can sun be a cause or it a prevention or help anyway?
So this is a tricky thing because sun, in a way, it helps in curing the disease. In helping the disease. Also, it can be a causative factor for the disease because there are sun is having a wide range of wavelengths of UVA rays, UVB rays, but there is a particular treatment for psoriasis with UVB rays, wherein this particular wavelength of light will help in the psoriasis treatment. So when you are exposed to sun for a particular time period and in a very graded manner, it helps in the management of psoriasis. But if you're exposed for too long, for too much of time, then it can be bad for psoriasis.
Doctor, what is psoriatic arthritis?
So psoriasis is, since it's an immune-mediated disease, it's also not just limited to skin. Patients who are having psoriasis, severe form of psoriasis, can get affected to other parts of the body. Like one of the most common is joints, wherein 30% of the psoriasis patient will develop psoriatic arthritis. It can affect any part of the body. Like it can affect from large joints like shoulder, elbow joints to smaller joints, fingers and toes, wherein the joints get swollen and develop symptoms of arthritis.
Doctor, it may sometimes happen, like in some part of the body, if person is cured with psoriasis, there are some of the areas stays frozen most of the time. So, what is the treatment, home remedy treatment one can do, having a frozen area for a longer period of time?
So that is a severe form of psoriasis. Psoriatic arthritis. I wouldn't suggest a home remedy for it. Better to get treated from the dermatologist.
Does physiotherapy helps out if a person is having joint pains?
Yeah, definitely. But not just the physiotherapy alone is not going to help the psoriatic arthritis. Definitely, he needs a systemic treatment also. Along with it, if he does physiotherapy, then it can be helpful.
Okay, you mean to say a medical treatment along with the physiotherapy can help a person improve better?
Yes.
Is it possible that if person has been cured with diagnosed with psoriasis and can again get diagnosed with psoriasis?
I didn't get you.
Is there a chances of psoriasis to be again diagnosed if treated later on?
Yeah, because it's a chronic condition. It is going to come back. It is not going to. It's not a one time treatment disease. It's a chronic disease, so it's going to come again. If there is any stress factor, or it can get come again. When you get treated, it can disappear and come again in your life.
Doctor, what are the any other conditions linked to psoriasis?
So we call it as a metabolic disorder because it is associated with cardiovascular disease or even gut tissues like Crohn's disease. The joints are affected, intestines are affected, and heart is affected. Even it can lead to hypertension, dyslipidemia, that is high cholesterol, and also diabetes, are all linked to psoriasis.
Doctor, other than joints, which are the body parts which are affected most during psoriasis?
Nails are affected, even nails are affected in psoriasis, scalp is affected. Patient will develop more itchy scaling on the scalp, and even the nails can have that, there will be nail pitting and all those signs.
Doctor, any internal organ is affected by psoriasis?
Yeah, so in a long-term patient who is suffering from psoriasis or severe form of psoriasis for many years, patient can develop cardiovascular disease like heart-related conditions, or even condition like diabetes, hypertension, even high cholesterol, all that.
Doctor, how long will a patient need to do medications?
So, if a patient is suffering from the diabetes, we don't ask the doctor, like, how long should I take the medicine? It's the same thing. Psoriasis is the same thing. We call it as diabetes of skin because it's going to be treatment for your life, because it's going to come back again and again, and there's going to be periods of remission, exacerbation. So, but we'll ask the patient to be on the treatment for a very long time.
What are the different types of psoriasis? Because there are every individual's psoriasis occur differently. So, what are the different types of psoriasis?
There are different types of psoriasis. Like one is most commonly it's called plaque psoriasis, wherein you get scaly plaques on the body, scalp, and there is one more variant called nail psoriasis, wherein the patient has only in the nails. Scalp patient comes with only the scalp. That's called scalp psoriasis. Or patient can have pustular psoriasis, wherein there will be small pus-filled lesions along with the psoriatic scales. And
Doctor, what are the preventions to be done? Because there are a lot of individuals who suffer with a lot of stress. So, what one must do to avoid this kind of stress?
To avoid this stress, like yoga and meditation will help. And also, if the patient is suffering from psoriasis for a very long time, keep the skin moisturized as much as possible, and avoid dry, cold weather. To use a humidifier if they're using continuous AC, and to avoid the medications that cause flare up, like certain medications like painkillers can cause flare ups in the psoriasis. So they can avoid that. And any injury in the body can also cause exacerbate psoriasis, like any cuts, wounds. So patient needs to be careful.
Doctor, we have been live, and right now we have viewers along with us who have a lot of questions us, and we have Sonam Sarthe with us, and her question is like, Doctor, who gets psoriasis and is it contagious?
Oh, so psoriasis is not contagious. So psoriasis can affect anybody in the world. The prevalence in the world is almost 1.5 to 2%. That is, I mean, it can affect any person in the world, like men, women, children. It's just that it is more common in the person, people who are having genetic predisposition. Anybody in the family, if they're affected, then they'll have that. It will be more common in that person.
Doctor, sometimes psoriasis becomes too much serious. So, what is the treatment procedure to be followed?
So there is a form of psoriasis wherein we call it as erythroderma, wherein more than 90% of the body surface area is involved with the psoriasis scale. So usually we advise the patient to get admitted, and we give a lot of fluids and a lot of emollients. And the patient needs a systemic treatment.
Individual should actually know about the test of getting psoriasis?
There's basically one test for to confirm the diagnosis, that is a skin biopsy. Anybody who is having doubtful lesion of psoriasis, they can get a skin biopsy done from a dermatologist to know the condition, get the diagnosis confirmed.
Doctor, how we can differentiate that psoriasis is severe and mild? Like, what is the duration? It stays for 2 weeks, 4 weeks, 8 weeks. Like,
It's not in the duration mostly. It's basically depends on the lesions. I mean, the skin surface involved, like how much percentage of your body is involved with the psoriasis. The severity is based on that.
Doctor, we have viewers along with us and they have some questions along with that. We'll ask some questions to you for the same. And they are, what is psoriatic arthritis?
Psoriatic arthritis is a condition wherein the patient with psoriasis can get joint pains. So it can affect any joint in the body, like shoulder, elbows, fingers, toes. They have the swelling and pain in the joint.
Doctor, what is plaques psoriasis?
It's a form of psoriasis wherein you have thick, scaly plaque, means it's a lesion, thickening of the skin. That's a form of psoriasis.
Doctor, what removes psoriasis?
Treatment with a good amount of moisturizing creams, and also there are creams in the form like steroids and salicylic acid creams, and there is vitamin D topical creams. There are many forms of topical treatments available which you can get treated from a dermatologist.
Doctor, do blood count deficiency may cause psoriasis?
There's no strong association with that.
And what are the factors to be taken care if one is with mild psoriasis? And he doesn't know that it is a psoriasis and they prefer like it's like 1 week pain, and what are the remedies they should take care of?
So moisturization, that is the key here. So keep your skin well moisturized, and you can apply mild, better to get treated from a dermatologist, but moisturization is better.
Doctor, we have viewers. I think your information is more helping out all the viewers. And that's, we have one more question. That is Feroz Khan. Why do we need to change or rotate treatments for his psoriasis?
So there is something called tolerance. Whenever we, since it's a long-term condition, the treatment needs to be for a longer duration. So when we keep applying the same cream for a very long time, the skin tends to get tolerant to that particular medication. So we rotate the different types of medications in a patient with psoriasis just to avoid this tolerance effect.
Doctor, how does psoriasis spread?
In a person or from person to person?
Person to person, and
it does not
individual.
It does not spread from person to person. So it's definitely not contagious. In a person, like I mentioned some of the triggering factors like alcohol, consuming a very low protein diet or inflammatory diet, and also stress or certain illness, or all these can weather, like cold weather, when especially winter season, the patient with psoriasis will have worsening of the symptoms. So all these can increase the symptoms.
Doctor, if one is having a mild psoriasis and one with having a severe psoriasis, do steroid is given to both type of patient?
Steroids is given in the form of creams and ointments. So definitely it helps in reducing the inflammation, scaling in a patient with psoriasis. So it's given in both patients, but because there are different types of steroids, there are mild steroids, potent steroids. Depending on the severity, we choose what to give.
Doctor, what are the effects of having steroids? There are individuals who doesn't have the capacity to adapt medications. So sometimes steroids gives a reverse effect, and what it might be and what precaution should be taken for the same?
Especially in psoriasis, we don't give oral steroids unless it's an exception cases. So creams and ointments based steroids will not cause side effects in a short term when it's given in a graded manner. But if it's applied for a very long time without the doctor's advice, then there can be thinning of the skin and rebound effect of the steroids and all that.
Doctor, what are the major deficiency in person's body causes psoriasis?
Recently, studies have been published saying that vitamin D3 deficiency can aggravate the psoriasis. So, getting exposed to sun a few minutes a day is going to help everybody.
Doctor, we have viewers along with us, and Sonia is having one question. So, what are the 5 P's of psoriasis?
Okay, so there is 5 P's of psoriasis. It's not
5 S of psoriasis.
Yes, yeah. So there is something called scaling and I mean
Doctor, what are the possible side effects of psoriasis if one is diagnosed for a longer period of time?
like I told, it can involve systemic in the body, like systemic. It can cause psoriatic arthritis. Patient can develop metabolic disorders. So, going to have a long-term effect on the heart, hypertension, diabetes, all that.
Doctor, if one start with a biologic, do they need to stop current regime for their treatment for their psoriasis?
See, biologic will be given based on the condition of the patient, like depending on the severity of the patient. It is best decided by the dermatologist who is treating you, so that they can decide whether it can be stopped or not.
Doctor, does psoriasis heal naturally, like without taking any medications or anything? Does it over the period of time gets healed?
No, it does not.
Okay. And if medication is not taken, only therapy is being consumed by an individual, a person gets treated by only physiotherapy. Does it work or is get better?
As
Or
I told,
medication is must?
different modalities of treatment are needed to, to keep the psoriasis under control.
Doctor, how can one boost their immune system or fight with psoriasis?
By having a good diet.
What all they should include in their diets?
A lot of vegetables, fruits and nuts, omega-3 fatty acids, protein foods, especially and can avoid mutton and oily foods.
Doctor, other than rashes and itchy skin, they have swelling in joints and frozen joints. Does heat pack or ice pack help to heal them, or is just a temporary relief?
Relief.
Okay. Doctor, we have a viewer along with us, Gayatri Sharma, whose question is, Doctor, is there more than one type of psoriasis?
Yeah, I've already explained about it. There are so many types of psoriasis. There's plaque type of psoriasis. Psoriasis just affects the nails, scalp, and there's something called pustular psoriasis. The different types of psoriasis.
Okay. Which are the common psoriasis being found in individual?
Mostly plaque type of psoriasis is the most common.
And what are the treatments dermatologists suggest when one gets diagnosed with that?
As I've already explained, so there are different types of psoriasis treatment, like they can be topical mode of treatment, depending on the severity of the disease. They can apply the cream solutions, and there's something called phototherapy, there's something called systemic treatment.
Doctor, can you tell more about oral and injected medications?
Okay. So, oral medications, there are different types of oral medications which act at the level of immune mediated cells. So, there's something called methotrexate, cyclosporin, vitamin D3 analogs. All this will help in the psoriasis. Biologicals are something, they're not natural molecules which mimic the immune cells of the body, like natural cells of the body, uh, which are given in the form of injectables.
Doctor, which are the alternative medications? Because most of the time the patient doesn't adopt the medications which are given by the dermatologist. So, what are the alternative medications, light medications for a longer period of time?
Uh, Alternative medications in the sense.
Like other than there are some supplements which doctor dermatologist suggest. Like non-veg or like fishy or fish food
Yeah,
oils.
basically omega 3 fatty acids will be given as a supplement because it helps in the skin overall skin health. But it has to be taken for a certain period of time.
It take 3 weeks, 1 week, the medication duration? If a person is with mild and one with severe, what is the duration of medications to be taken for?
Depends on the severity of the disease. Each person is different. You have to see how the person is responding to the particular treatment. Depending on that, we'll be giving treatment.
Okay, so observantly, for a mild patient, psoriasis, mild patient diagnosed, how many days they should take the medication?
It depends. Usually, it will be months.
Okay. Doctor, what all advices would you like to give all our viewers? And also we have Ankita Bwade, whose question is there any specific areas where psoriasis commonly occur? One of her friend is having the same area again and again.
Yeah, so it usually occurs in the areas elbows, knees, initially most common areas, elbows, knees, or the scalp, where the patient will have repeatedly. So you will have to consider psoriasis when you get lesions in these areas.
Doctor, what all advices and a takeaway advice you would like to give all our viewers?
So psoriasis is definitely a chronic condition that should kept in mind because patient needs a treatment for a very long time here. So it also affects the psychological well-being of a person. It's not contagious at all, so there's nothing to be worried about when you get psoriasis. And definitely, it can be treated. It can be kept under control. So do not worry if you get psoriasis. It With the most advanced treatment nowadays, we have good medications to keep it under control.
Doctor, does itchy areas, okay, the or wet areas more chances of psoriasis?
Itchy areas in the sense?
Where person gets sweats a lot. If a person is sweating a lot and a person is diagnosed with psoriasis and feels more itchy, can it increase?
No, not directly related. Um, Basically, it's the dry weather which will exacerbate the psoriasis.
Okay, thank you so much, doctor. Let us know what is the takeaway advice, a small advice, a one liner, which you would like to give all our viewers.
So psoriasis can be treated. It is not contagious. So make sure you get proper treatment from a dermatologist. Um,
Thank you so much, Dr. Nydile S V, for your valuable time. It has been very informative session for all our viewers, and I'm sure they will use this information and prevent themselves and their friends, their near and dear ones, from getting psoriasis. And in case of that, they see such symptoms, they know that instead of self-medication, it's better to approach a nearby dermatologist. It's great to hear you, and we are really looking forward for many more such sessions in the coming time with you for all our viewers. Thank you, viewers, for your active participations. To get latest updates on how to keep your skin healthy, do like and follow our FB page, all about skin well-being. We're also available on YouTube, Twitter, and Instagram. Have a great day ahead and take care of yourself.